Lonely and isolating are words we've used a lot to describe the pandemic, but they are also common ways to describe eating disorders.
Yeah, 5 on Your Side's Tracy Henson explains how COVID-19 has impacted people with eating disorders, especially children.
I know it's something that is so lonely and so isolating.
Lexi K isn't describing pandemic lockdowns or virtual meetings.
I've struggled with my eating disorder for about 9 years now.
In 2020, she found herself needing immediate treatment.
Many different treatment centers. While in the pandemic, it seemed like all these treatment centers had wait lists that were, 8, 10, 12 weeks long.
Demand for adult care and child care, specifically for eating disorders, skyrocketed when COVID hit the U.S.
Sadly, we've seen a huge rise in the cases of eating disorders in the St. Louis area. Eating disorders thrive in secrecy and isolation, and the pandemic was kind of a perfect setup for that.
An influx in cases for a small group of specialized healthcare workers.
The rate in which we were seeing people reaching out for help is the highest I've ever experienced it, and it still is.
With outpatient and residential treatment waitlists growing, hospitals are picking up the slack, taking in more critical eating disorder cases, especially pediatric patients.
Kids are coming in sicker because sometimes they haven't seen their pediatrician through the pandemic, or again, they just aren't around the people who might catch this sooner.
If you or someone you know may be suffering, the Missouri Eating Disorder Association has insurance, treatment, and support resources available. Tracy Henson, 5 on Your Side.
And we should mention Tracy is hosting the Missouri Eating Disorder Association Benefit Gala tomorrow night. This year, the association is raising funds to start free therapist-guided support groups. In-person and virtual tickets are also still available.